You wake up in the morning, your knees feel stiff, your fingers ache when you reach for your coffee mug, and the worst part, you know exactly what your doctor is thinking. You are getting older. This is just what happened, but here's what your doctor might not tell you, that stiffness and pain isn't inevitable. It's inflammation. And more importantly, it's something you can actually do something about, not with expensive medications, not with risky procedures, but with real natural changes that work at the source of the problem. In the next 20 minutes, I am going to show you exactly which foods reduce inflammation, the exercise that most seniors are doing wrong, and a simple morning routine that my patients tell me changes their entire day. Stay with me. If you have joint pain or stiffness, please hit like and subscribe. Thousands of seniors are using this information to walk without pain again, and you deserve that too. Let's get started. I'm Dr. Alex Mandell for the past 15 years. I've specialized in helping seniors manage chronic pain without relying solely on medications. And I want to be clear about something from the start. What I am about to share with you is backed by real science, not trends, not wishful thinking. Real peer-reviewed research from places like the Mayo Clinic and the National Institutes of Health. But here's what surprised me most when I started this work. Most of my patients didn't realize that their joint pain was actually connected to inflammation happening inside their bodies, not just in their knees or hands, but everywhere. I had one patient, Margaret, 68 years old, who couldn't pick up her grandchildren anymore. Her hands hurt too much. She tried everything, creams, supplements, even cortisone shots. Nothing worked. But when we addressed what was really causing the inflammation, everything changed. I will tell you her full story in just a moment. But first, let me explain what is actually happening inside your joints when you feel that pain and stiffness. Think of inflammation this way. Imagine your joints are like the hinges on a door. When those hinges get rusty or swollen, the door doesn't open smoothly anymore. Your body's immune system is supposed to protect you, right? But sometimes, especially as we age, that system gets confused. It starts treating healthy joint tissue like it's under attack. When that happens, your body floods that area with inflammatory chemicals. These chemicals cause swelling, pain, and stiffness. It's your body trying to protect you, but it's actually making things worse. Myth: joint pain is just a normal part of aging. Fact: pain is a sign that something, usually inflammation, needs attention. And that is actually good news because it means you can change it. Here's what most seniors don't know: your diet, your sleep, your stress level, and even how much you move. These things directly control how much inflammation is happening in your body right now. I remember speaking with a 71-year-old patient named Robert who came to see me because his arthritis was so bad that he couldn't grip a golf club anymore. He had been playing golf every Saturday with his friends for 30 years. When he couldn't do it, he felt like he was losing his independence. His children noticed something was changing. Their father was getting depressed, staying home more, disconnecting from his friends. What happened next surprised even him. We didn't change his medications. We changed what he ate, how he moved, and how he managed stress. Within 6 weeks, he was back on the golf course. Not just playing, but feeling like himself again. And the most surprising part, the changes that helped Robert are not complicated. They are actually things you can start doing today. But I want to walk you through the science first so you understand why these things work. Because when you understand the why, you actually stick with it. If you are dealing with joint stiffness every morning, please share this with someone you know who's struggling too. And if you haven't subscribed yet, do it now. I am releasing videos specifically designed to help you move without pain. Let's talk about the single biggest thing you can do to reduce inflammation: what you eat. Most seniors I work with are actually eating foods that make inflammation worse without even realizing it. These aren't bad foods exactly, but they are fueling inflammation in your body while you are trying to reduce it. Here are the foods that reduce inflammation. Write these down. 1. Fatty fish salmon, mackerel, sardines. These contain omega-3 fatty acids. Omega-3s literally calm down the inflammatory chemicals in your body. Just 2 servings a week, that's it. Most of my patients see changes within 2 weeks. Susan, 72, told me she started eating salmon twice a week. 3 weeks later, she noticed her morning stiffness was gone. Her husband said, "I haven't seen you move that easily in years." She thought it was normal aging, but it was inflammation, and the omega-3s fixed it. 2. Leafy green spinach, kale, arugula. These are packed with antioxidants. Think of antioxidants like little firefighters. They put out the inflammatory fires in your body. 3. Berries, blueberries, raspberries, strawberries. These have something called anthocyanins. These molecules directly reduce inflammation. 1 handful of berries with breakfast, that's all you need. 4. Olive oil extra virgin, real olive oil. The compound in olive oil called Oleocanthal works almost exactly like anti-inflammatory medication without the side effects. 5. Ginger and turmeric. I want to spend a moment on these because they are powerful. Turmeric contains curcumin, and research shows curcumin reduces inflammatory markers in the blood just as effectively as some medications. But here's important. Turmeric alone is not absorbed well by your body. You need to combine it with black pepper, which contains piperine. Piperine increases turmeric absorption by over 2,000%. That's not marketing, that's biochemistry. Now, there are foods you should reduce or eliminate, and I am going to tell you which ones in just a moment. But first, I want you to know that adding these anti-inflammatory foods to your diet is the most important step. Focus on addition before subtraction. Processed oils increase inflammation. Sugar, especially added sugars, feeds inflammatory chemicals. And processed foods are designed to be addictive and inflammatory. I remember speaking with a 68-year-old patient, Thomas, whose knees were so painful he couldn't walk down the stairs. His main diet consisted of frozen meals, processed snacks, and soda, convenience foods. When he started eating real, whole foods, and especially when he added omega-3s and turmeric, his pain dropped by 60% in 2 months. His children noticed he was moving around the house again. He felt alive again. If this is resonating with you, please like this video and share it with someone who's struggling with joint pain. The people who win with this are the ones who take action. That could be you. The second major thing you need to know, movement reduces inflammation. But here's the catch. The wrong kind of movement makes it worse. Most seniors I work with are either doing nothing because they are afraid of hurting themselves, or they are doing too much, too fast, which actually increases inflammation. There's a middle ground, and that's where the magic happens. Here are the types of movement that reduce inflammation: low impact exercise, walking, swimming. Water aerobics, Tai Chi. These move your joints without shocking them. Water exercise is especially powerful because water supports your weight while you move. Studies show seniors who do 30 minutes of water exercise 3 times a week see major reductions in joint pain. Gentle stretching. This is not flexibility for flexibility's sake. This is about reducing tension that's holding inflammation in your joints. Even 10 minutes a day makes a difference. Resistance training, light weights or resistance bands. Stronger muscles protect your joints. Weak muscles force your joints to work harder, which creates inflammation. One of my patients, Eleanor, 76, told me she had stopped exercising completely because she thought movement would make her arthritis worse. She was sitting on the couch most days. Her family was worried. She felt like she was declining. When we started with just 20 minutes of water walking 3 times a week, combined with the anti-inflammatory diet, everything shifted. Within 4 weeks, she had energy again. Her grandchildren said, "Grandma is like a new person." She told me, "I didn't realize I was choosing to feel this way." Here's what works for most seniors: 20-30 minutes of movement 3 times a week. Mix low-impact cardio with gentle stretching and light resistance work. Start where you are. If you can only do 10 minutes, do 10 minutes. It's not about perfection. It's about consistency. The beautiful part, movement is free. Water walking costs nothing. Tai Chi DVDs are cheap. Resistance bands cost $10. This is not about expensive gym memberships or equipment. Most seniors miss this next point completely, and it's why some people see amazing results and others don't see much change. It's about sleep, and the relationship between poor sleep and inflammation is stronger than most people realize. You are doing great. You are learning the real science behind joint health. Like this video if you are committed to feeling better. And subscribe so you never miss the specific exercises that help the most with your particular joints. Here's what research is absolutely clear about. Poor sleep increases inflammation. When you don't sleep well, your body produces more of the chemicals that cause joint swelling and pain. Studies show that seniors who get less than 6 hours of sleep have inflammation levels that are 30-40% higher than those who get 7 to 9 hours. That's not small, that's significant. What about stress? Chronic stress literally bathes your body in inflammatory chemicals. When you are stressed, your nervous system releases cortisol, which suppresses your immune response, and your body compensates by producing more inflammatory chemicals. I remember speaking with a 69-year-old patient named Patricia. Her husband had recently passed away. She was caring for her granddaughter. She was stressed, sleeping only 4 or 5 hours a night. Her hands ached so much that she couldn't braid her granddaughter's hair, something they had always done together. We didn't just change what she ate. We addressed her sleep. We talked about stress management. She started meditating for 10 minutes a day. Within a month, she was sleeping 7 hours. Within 3 months, she was braiding her granddaughter's hair again. She was rebuilding her life. Consistent sleep schedule, go to bed and wake up at the same time. No screens 30 minutes before bed. Keep your bedroom cool. Avoid caffeine after 2 p.m. If you are waking up with aching joints, you might need to adjust your sleeping position. We will talk about that in just a moment. Meditation doesn't have to be complicated. 5 to 10 minutes, sitting quietly, focusing on your breath. That's meditation. Studies specifically show that seniors who meditate regularly have less inflammation. Walking in nature, deep breathing, time with family. These are not just nice things. They are powerful anti-inflammatory tools. A few more things that matter. Hydration, dehydration increases inflammation. Drink enough water. Simple weight management, extra weight creates inflammation. This is not about vanity. This is about reducing the inflammatory load on your body and your joints. Social connection, loneliness increases inflammation. Time with friends and family reduces it. This is medicine. I want to tell you about Frank, 73. He came to me with severe knee pain. He was depressed because he couldn't hike anymore, something he loved. His children had suggested assisted living. He felt like his independence was slipping away. We addressed his diet, his movement, his sleep, and here's the part that surprised him. We made sure he was spending time with his friends. He joined a hiking club that moved at his pace. Within 3 months, he was hiking again. His children saw him like they used to. He got his life back. Here's what I want you to remember. Joint pain is not something you have to accept. Inflammation is not inevitable. The choices you make, what you eat, how much you move, how well you sleep, how you manage stress, these choices directly control how you feel. You don't need to change everything at once. Pick one thing. Start with the anti-inflammatory foods, add movement, then improve your sleep. Over time, these small changes compound into a completely different experience of your body and your life. Thank you for watching. Your independence matters. Your quality of life matters. And I am here to help you protect it. Please like, subscribe, and share this with anyone who needs to hear it. This is Dr. Alex Mandell. I will see you in the next video.